Welcome to another RCSI Sim model making video. Today we're looking at our own Miroslav Wyborski's pressurized aorta. Here are a couple of action shots of it at a recent cardiothoracic training day for aortic cannulation. Here's everything you'll need to create this model. We use 20 centimeters of porcine descending aorta, as this allows each model to be cannulated multiple times. We start off by cutting the bovine carotid artery longitudinally. This is used as a patch to seal off all of the branches from the aorta. It's not particularly important what kind of vessel you use, just once it's long and wide enough to cover all the aortic branches. Using a swab, dab the vessel dry. This is key, otherwise it will not stick with the tissue glue. Miroslav is now just trimming off the last bit of fat from the aorta. Flatten down the aorta and give it a good wipe down with the swab, and ensure that you've exposed all of the holes. Apply a generous amount of tissue glue to the carotid. We highly recommend using 3M's vet bond, which we unfortunately run out of here and have to use as an inferior alternative. Lip over the aorta and slap it down onto the carotid. Using a swab, then apply pressure to the tissue to make the adhesion. A rolling motion like so can help get an even dispersion of the glue. There may be a couple of loose edges which can be glued up afterwards like so. Then trim off each end of the vessel so you're left with nice even edges. Get the Foley catheter and place the tip inside one end of the aorta. The inflatable balloon must sit inside the vessel, so make sure this section of the catheter is within the aorta. Fetch the 20ml syringe and inflate the balloon with roughly 10 ml of water. The balloon should effectively plug the vessel. Give it a little tug like so. Miroslav adds another milliliter or so just to make sure that it's fully airtight. For the other end, we simply clamp the edge with extra large artery forceps. A bowel clamp or Kelly clamp or other hemostatic instrument will work equally well. We then use regular super glue to adhere the catheter to the giving set. Apply a generous amount inside the lower lock collector and jam in the port of the catheter until it sticks. Release the clamp and let it flow. So we've encountered a small leak here, nothing to get worked up about. We simply seal off any protruding edges. Again, can't recommend vet bond enough. And we give it another bash. Look at that, perfect. A well perfused aorta.